Hello, my name is Azura Mohd Affandi. I'm a consultant dermatologist working in Hospital Kuala Lumpur in Malaysia, and I would like to share with you my experience in treating patients with psoriasis in Malaysia. This is the map of Malaysia. Malaysia is divided into Peninsular Malaysia and also Borneo, consisting of Sabah and Sarawak. There's about 34.5 million population as of March 2024. And Malaysia encompasses three major ethnic groups, namely the Malay, Chinese, and Indian. In terms of the number of dermatologists, we do not have enough dermatologists in Malaysia. As you can see, in total, we have only about 189 dermatologists serving about 34.5 million population in Malaysia. And that gives rise to overall about 0.55 dermatologists per 100,000 population. Since Malaysia encompasses three major ethnic groups, which is the Chinese, Malay, and Indian, they have different skin color tone. And if you can see here, in a lighter color tone patients, for example, in these Chinese patients, the plaque appear more reddish and pinkish, compared to patients with darker skin tones in Indian patients, where it's very difficult to appreciate the erythema on the plaques. In Malaysia, we have Malaysian Psoriasis Registry, where we collect data on patients with psoriasis in Malaysia. And these are some of the reports that has been published and is available on the website. Just to share with you, in total, there's about 23,803 patients notified to the registry between 2007 to 2019. However, just as a note, notification is voluntary, and I'm sure there's actually more than 23,000 patients with psoriasis living in Malaysia. Majority, they are adults patients, about 91.5% of them. In terms of male to female ratio, we have slightly more male patients with psoriasis in Malaysia. The mean age of onset is of the young onset, 35.4 age group. And about 23% of patients have a positive family history. And this is the ethnic background where majority of our patients were Malays, followed by Chinese and Indian. And this follows the ethnic breakdown of the Malaysian population. Plaque psoriasis remains the commonest type of psoriasis in a Malaysian adult patient, and it's reported to be in about 90.4% of our adult patients with psoriasis in Malaysia. The other types of psoriasis are not very common. In terms of severity, more than 50% of our patients have body surface area involvement of less than 5%, and there's about 18% of patients with body surface area involvement of more than 10%. About 13.8% of our adult patients have psoriatic arthritis, and unfortunately, when it was first diagnosed, joint deformity occurred in about 23% of adult patients. We know that psoriasis is associated with metabolic syndromes such as obesity, hypertension, diabetes, hyperlipidemia, and non-alcoholic fatty liver. What about our patients in Malaysia? As you can see, majority of our patients were overweight, about 58% of them. And this is followed by hypertension in about 26% of patients. Hyperlipidemia was found in 18% of patients. About 17% of our patients have diabetes mellitus, and ischemic heart disease is reported in about 5.3% of our adult patients with psoriasis in Malaysia. Just to share with you, we also have the Malaysian Clinical Practice Guidelines on the management of psoriasis, but this was published way back in 2013. At the moment, it's undergoing revision, and we expect to get it published hopefully by 2025. These are the treatments that's been offered for patients with psoriasis in Malaysia. We have topical treatment, phototherapy, conventional systemic agents, and also biologics. These are some of the examples of topical treatment that's provided to our patients. And these are the phototherapy service that we have. We have both UVB and UVA. But unfortunately, the service is only provided by selected hospitals. Mainly they are public hospitals, and usually patients will undergo treatment twice a week. Conventional systemic agents are offered for patients with more severe psoriasis, and we have methotrexate, cyclosporine, and acitretin for patients with moderate to severe psoriasis. And if it doesn't work, Biologic would be our next modality. And as you can see here, we have all types of TNF-alpha inhibitors, IL-12/23 inhibitors, IL-17 inhibitors, and IL-23 inhibitors. But only those that's marked in red that's currently available and registered to be used by patients with psoriasis in Malaysia. If we look at this table here, just to share with you, despite having patients eligible for more aggressive treatment with biologics, unfortunately, because of limited fundings, our patients with psoriasis in Malaysia have low access to biologic compared to other countries. If you look at the table here, only 1.7% of patients in Malaysia receive biologics, and this is definitely low if we compare them to patients in other countries stated in this table. Another thing that I would like to share with you, we have a very active psoriasis patient support group in Malaysia, and they've been working hard in educating patient and also public with psoriasis in Malaysia. There are currently at the moment about 3 psoriasis patient support groups in Malaysia. The main one is the Psoriasis Association of Malaysia, and we have one in Johor and one also in Penang. This is the Malaysian Psoriasis Association website, where they put information on what psoriasis is all about. There's also a link to the dermatologists and rheumatologists that's practicing in Malaysia, and what are the activities that been offered by the association. This is their Facebook and also their Instagram, where a lot of information are shared. For example, patient's journey, any events that we plan to have, motivational quotes, general advice, and so on. So basically, it's just a space for patients to connect with each other. These are some of the activities that we had over the years. There are countless, a lot of activities being organized by the patient themselves and also by the healthcare providers for patients with psoriasis in Malaysia. And this is just to share with you what we did in 2022 for the World Psoriasis Day celebration. A lot of activities, educational and also fun activities were arranged for our patients. We also disseminated information to the public via radio, newspaper publication, and also television appearance, where we discuss about what psoriasis is all about, the myths surrounding it, and treatment available for patients. We also collaborated internationally. The Psoriasis Association of Malaysia is a part of International Federation of Psoriasis Association, where we had been involved in a lot of activities, forums, at an international level. In summary, psoriasis is one of the common skin diseases in Malaysia. However, as you can see, we do not have enough dermatologists to serve the big population in Malaysia. Definitely, we need more dermatologists, and we are in the process of training more dermatologists, and hopefully in the future, we are able to provide better dermatology service to the Malaysian population. As you can see, we also have about 18% of patients with severe psoriasis in Malaysia, but unfortunately, because of a limitation in the fundings, we were unable to cater to all patients with severe psoriasis in terms of adequate treatment and treating them with biologics. And last but not least, I've already highlighted that patient support group is important. It helps to bridge between the patients and public and also the healthcare provider. And I'm happy to say that the Psoriasis Association of Malaysia has been doing a wonderful work in terms of educating the public and also organizing activities for patients with psoriasis in Malaysia. With that, I'd like to end my presentation, and I hope this presentation has given a glimpse of how we manage psoriasis in Malaysia, and also to provide some highlights of what are the patients' support group activities in Malaysia. With that, I thank you. Goodbye.